Hello, my name is Professor William Whiteley and I'm a neurologist. I'd like to tell you about the Dementia Trials Accelerator. We're procuring a service to improve the efficiency of clinical trials in the United Kingdom. We're calling this a Brain Health Community Assessment for Trials service. This is being supported by the Dame Barbara Windsor Dementia Goals Programme, UK Dementia Research Institute, Health Data Research UK and the UK MRC. The Dementia Trials Accelerator aims to position the United Kingdom as the destination of choice for late-phase clinical trials in the dementias and neurodegenerative diseases by improving the efficiency of trial recruitment. We want to be able to recruit people at scale by using population-based cohort studies and data collected in the NHS. We want to make sure that we can measure relevant biomarkers to identify people at high risk or to diagnose people with the correct dementia type at scale and rapidly. We'd like to make use of the health data science expertise we have in the United Kingdom, as well as our really great track record in clinical trial innovation, design and delivery. The two partners running the Dementia Trials Accelerator are the UK Dementia Research Institute and Health Data Research UK. The Dementia Research Institute is the UK's leading institute for dementia and related diseases, and it aims to transform the lives of people affected by these conditions. It's supported by 6 funders and supports over 1,000 researchers in 8 UK centres. Health Data Research UK aims to unite the UK's health and care data to enable discoveries that improve people's lives by uniting, improving and using health and care data in one national institute. It's supported by 10 large funders and supports researchers in over 31 UK locations. The Dementia Trials Accelerator aims to support clinical trials taking part in the United Kingdom through the service we're trying to procure today, which is the Brain Health Community Assessment for Trials service. We'll also be developing and validating a biomarker toolbox for trial delivery at scale and supporting novel trials, for example AD Smart, which we're using as a use case, in order to pave the way for industry-supported trials. There are 3 pillars of our approach. First is a data and connectivity approach, where we're developing a single UK shop window for clinical trialists to be able to identify relevant cohorts. Secondly, we're working in biomarker innovation to try and find those markers that are best placed to identify people for preventative and treatment trials at scale, either in blood, digital or in genetics. And lastly, what we're hoping to procure today is a hybrid delivery model for community assessment for trials. This is a public-private partnership, and for our purposes we'll be aiming to recruit people from the community, pre-screening them to identify populations who are most likely to be able to take part in studies. In addition, we will eventually recruit from brain health and memory clinics and include at-home cognitive testing. The strategy for the Dementia Trials Accelerator Brain Health Clinical Assessment for Trials service is to use population data sources to accelerate trial enrolment. Many people who are at risk of dementia or have a dementia diagnosis are currently collected in NHS and population cohorts. We'd like to find those people to take part with consent for recontact to identify a population who we'll target and invite to take part in studies. Those people will then be invited to a community assessment service where they have their biomarker measured and potentially have cognitive testing. This recruited population we're going to call the Brain Health Community Assessment for Trials Service, a partnership with the DTA. For our pilot, what we'd like to do is to concentrate on the community aspect of the Brain Health Community Assessment for Trials service. We'll be doing community-based pre-screening for enrolment to clinical trials. We'll try and identify about 10,000 people who are potential clinical trial participants in the first year and operate in about 4 to 10 locations across the United Kingdom, with a preference for an even distribution of sites across areas of deprivation and by region. We'd like the service that we procure to be able to arrange appointments for identified participants, to take and record consent from the participants, to arrange community-based blood sampling collection, and be able to secure the preparation, centrifuging and storage of samples at -20, and then delivery of those samples to one or more UK locations where biomarkers will be measured. There should be data collected in a secure database and shared with the contracting organisations. The service will train staff in blood taking, in clinical assessment, and be dementia trained. Out of scope for this call are sample analysis, data analysis, and data management. We'd be really delighted to work with you to refine the service specifications collaboratively before the formal procurement process begins. If you're interested, please contact us at procurement@hdruk.ac.uk, and we'll then arrange one-to-one meetings with you to discuss our requirements. We'll then also be able to invite you to planned workshops. We anticipate discussing during those one-to-one meetings to try and understand your perspective on how this service might be delivered, to understand an appropriate commercial model and indicative costs, to be able to refine the specification ahead of procurement, including feasibility and incorporation of cognitive assessments, and various marketing approaches for inviting potential participants. And we'll use all of these to inform a contract ahead of the procurement notice. We anticipate advertising procurement notice towards the end of January of 2025. Thanks for listening.